Senator Hassan.
Thank you very much, Senator Cassidy. And Mr. Chairman, thank you for holding this hearing. And Dr. McCance-Katz, thank you so much for being here and for the work you do. I want to follow up on the conversation we were just having about funding for those of us who are from states that have been incredibly disproportionately impacted by a horrible epidemic that is taking lives, obviously, across our country. But in New Hampshire, our fentanyl, heroin, and opioid epidemic is referred that way because it is fentanyl that is killing people in my state at one of the highest, if not the highest per capita death rate in the country. And we have been targeted by fentanyl dealers. I was at a funeral Saturday where a family buried their second daughter from an overdose, a woman who had been in recovery and had been working really hard at it. And this disease is taking all of our efforts, and I am very, very grateful to everybody on this committee, but I will add my concerns and frustrations to what you heard from Senator Whitehouse. I have expressed them directly to the Secretary. I think the fact that states were uncomfortable about reapplying is not an excuse in terms of the decision that was made with the second round of this funding. Towards that end, Senator Alexander, Senator Capito, Coons, myself and Senator Manchin have a bill in called the Targeted Opioid Funding Act that would change the formula and make clear what kind of priority we should give to per capita death rates. And I'd love the committee's attention and collaboration on the bill. But even if we fix this formula under the Cures Act, we know that the Cures Act money right now is only for 2 years, and we know that there is no quick fix for this epidemic. We desperately need funds to fight this epidemic. We need the administration to tell us what supplemental resources it's proposing to turn the tide. And I was appreciative of being at the White House in October when the president declared this a public health emergency. But so far, we haven't seen any follow-up to that declaration, and we've seen no proposal from the administration for the funds that we need to tackle this epidemic everywhere in our country, an epidemic that is not only taking lives, but in New Hampshire, I think the year was 2014 or 2015, cost us over $2 billion in our economy. So, Dr. McCance-Katz, have you had conversations about the need for additional funding with HHS and the White House? Why hasn't this administration called for additional funding or proposed additional funding so we can get the dollars and the resources to the front lines where it's so needed?
Senator Hassan, I think that there are many conversations going on about what the needs are, and lots of efforts to look at the data that's available, the information that's available. It's my understanding that the administration is very interested in working with Congress on developing those ideas that might be something that both the President and Congress can agree upon to bring more resources to bear.
Well, this Congress has made very clear that we support additional funding to fight this, but we really need a partner in the administration to stop talking and start funding. And so I would look forward to continuing those conversations. I also wanted to follow up with another question because we know how complex the opioid use disorder is. It's often accompanied by a variety of mental health disorders, including, for example, post-traumatic stress disorder. This leads to complex and sometimes very dangerous outcomes. Veterans and other populations with PTSD and co-occurring pain conditions are often prescribed higher doses of opioids, putting them at a greater risk for accidental overdose and deaths. Treating one disorder obviously does not address symptoms of the other. It's imperative that we work to ensure that patients have access to comprehensive treatment to address both substance use disorders and mental health needs. Doctor, have the mental health provisions in the 21st Century Cures Act helped SAMHSA enhance the availability of evidence-based treatment programs for dual diagnosis of mental health disorders and opioid use disorder?
Yes, I believe they have, and specifically I can speak to the issue around Department of Defense and Veterans Affairs, which Cures addressed, and which has developed into a very strong relationship where SAMHSA works collaboratively in an ongoing way, and we specifically address the issues of mental disorders and the opioid epidemic, as well as suicide. Those are the big issues that we are working on right now. And we also can use the information that we learn from the VA, which actually does a lot of research of its own, and we share this and we promulgate it to communities.
Well, I thank you for that, and I thank you for the vision of integrated healthcare in this area. I am most concerned that we are delaying some of our work that would be made possible with extra funding because of the stigma attached, as many of the other senators have referenced, and I appreciate very much your efforts.
Thank you.